Hello, everyone, and welcome to episode 7 of the Mission ICU talk show, where we invite different leaders from the CSR space and from the social space, especially in Indian healthcare, to come and talk to us about some challenges in rural India. Today's topic is very, very interesting. It's about telemedicine, the pros and cons. And to talk to us today about this is our guest, Parthasarathi Chandgar from AkzoNobel. Why don't you start by introducing a little bit about yourself and also a little bit about the organization that you work with?
Good afternoon, everyone. I'd like to especially thank Mission ICU for inviting me for this talk show. And I'm really excited to share my limited knowledge and information about the CSS space and about telemedicine with you all. As you said, to be just quickly introduce myself, my name is Parthasarathi. I lead CS at AkzoNobel. It's almost been 7.5 years I'm working here. I have almost around 17 to 18 years of experience. I basically done my master's in social work from Delhi University. And of the out of the 18 years, 16 years I have been into CSR. Now coming to about my company, AkzoNobel India. AkzoNobel has a very strong tradition and rich culture. It's more than a 200-year-old company, and in fact, it was started by Sir Alfred Nobel, the founder of Nobel Prize. So it's a global MNC. We are into primarily into paints and coating industry, present in almost 175 countries all over the world. Dulux is a very popular product of ours, and so basically, we have a paint and coating for all surfaces, be it a aeroplane, be it a furniture, be it a metal surface. For every surface, we have a solution. We have a coating, right? So that is in brief about myself and example.
Super. Thank you for sharing that. I had no idea that you had a solution for every surface. So that is great to know. And also to understand that this is a global company with presence in 175 different countries. And since you are leading the CSR in India, why don't you tell us how the CSR legislation in India is unique and what makes it so special?
So if you typically see CSR in India, not exactly it was termed as CSR, but it has been practiced by Indian businessmen for past 100 150 years. We all know about the contribution of companies like Tata and Birla, which where they are undertaking various social development programs. So to be, but maybe the word CSR have been coined recently, but the rich India always has a culture of giving it back to the society. Now, if I talk about legislation, to be very honest, I have been in CSR from since 2006. So, in fact, I have also seen a lot of change in the way CSR is being practiced. I would say it have evolved from a culture of philanthropy to now more strategic approach. So, what the unique part of India is one of the major economies where CSR is compulsory, made compulsory. I would say like Companies Act has really helped us in strategizing our CSR into key focus areas. So it has very clearly defined how we can do CSR, who can be your implementing partners, which are the key focus or national priority areas where you can focus, which is mentioned in the Schedule 7. I believe this has really helped to in making it a more concreted effort, because there were too many areas that companies are focusing which was not making a great change. But I think by focusing on key focus areas and by defining what can be ideal CSR, I think CSR have been in the last 5 7 years have been more strategic if you compare to CSR in earlier days.
Great. Thank you for shedding a little bit of light on the company's act and key focus areas of CSR as stated by the government. So, what are some key projects and key focus areas of your organization at the moment?
Right. See, the thing is that when we thought about starting doing a CSR, we were very sure that we wanted to do CSR, which we can be deeply involved with. It's not something we just didn't want to give away money or donate something. So that was very one thing, but very sure that we want to use our in-house knowledge and strength while designing CSR. That is how the whole process of brainstorming of the CSR process or CSR focus area started. So after doing that, we realized that being a paint and coating company, we have a lot of knowledge in the area of paint and paint application. And it is where in India, skill training is one area where still nothing much work has been done, especially in the blue collar space. And it
Mhm.
covers talk about paints, especially paints. Vocational skill training is available, as such, for the fresh youth. So that is how we initiated AkzoNobel Paint Academy, which is a flagship CSR project. So we in these skill academies we provide vocational skill training in painting. One is for the decorative paints, which you apply in the walls, and other is for the vehicle paints. So we have around now 8 centers, of various parts of the country, in Delhi, Kolkata, Navi Mumbai, Bangalore, and various other cities, where we provide this skill training to the youth. So basically, it's 1 month program where the youth takes a training, and once the training is over, the youth is linked to employment as a painter. Apart from implementing it directly, we strongly believe in collaborating with other corporates to get a synergy to make more impact. So currently, we are working with Tata Steel in running a training center in Jamshedpur. We are working with ACC Cement in running a training center in Jamul in Chhattisgarh. We are working with Dalmia Bharat in running a center in Belgaum, Karnataka. One of the key focus areas we have always kept in mind is that in skill training also we wanted to focus on diversity and inclusion, which I believe is a very important part of it. If you typically see paint application sector, it's a 100% male dominated section, right? You won't find any female painters. So this is where we focused for the past 3 years in inviting more and more girls and women in the sphere of skill training. And we are happy in the last 2 years, we could train almost 700 women painters and link them with employment. So that is one thing we really wanted to break the gender barriers. And to be very honest, they are doing great work. The employers are really happy with the work. And we are now increasing seeing the trend of more and women joining this particular field. A few more focus areas, like as a part of diversity and inclusion, because we believe D&I doesn't mean only of the female gender; it's a much more wider definition. So we do skill training for people who are imprisoned. We are working with Thane Central Prison, where we have been doing working for the past 1 year. We have trained over 100 inmates. Before that, we have worked with Faridabad District Prison, where we have trained more than 300 inmates. We are training people from the LGBT community. We are people training people from with different abilities. And recently, we have also started a training for youth who have been rehabilitated from drug use in Imphal, Manipur. So by doing this, we are trying to touch upon various disadvantaged groups. Who is very difficult for them to return back to the main society. So we are using it this paint application training, as a way to come back and get rehabilitated society and lead a dignified life. Uh, Apart from skill training, two other focus areas quickly. One is education for the children. So we are working with various state government schools where we are trying to provide better infrastructure in the schools, provide remedial education in the schools, promote science education, strengthen the parent-teacher associations, promote life skill education. So we're working with more close to 4,000 children in 5 states of India in promoting education in the schools. Lastly, I think the topic where I'm here to speak, telemedicine. So we are working with state government of Karnataka and Madhya Pradesh in telemedicine project, where we have set up telemedicine centers in the primary health center of the hospitals, and we are catering to population of almost 60,000 60,000 villagers, through this project.
Wow, wow. So wonderful to hear about all the three different areas and also the focus on diversity and inclusion. I think this is the first time I'm hearing about such a diverse program, which is not only including women but also rehabilitation of prisoners and former victims of drug and alcohol abuse. So it is wonderful to hear about all the impact that you are making along with AkzoNobel. So this brings me to my next question, which is what is the benefit of CSR to the organization and the employees? It is obvious that you are creating an impact in society, but what about the impact that CSR creates on the organization itself? Maybe this is intangible in terms of culture or fulfillment, satisfaction. Can you shed some light on that?
Sure, sure. I believe we are all part of society, right? So what we say is that thriving society means thriving business. So it's very important to focus on all around development of society if you want to have a steady business. So quickly some of the points that I think makes a difference is that first of all it helps you to be known as an organization which has a very strong ethics, and this is one of the believe I believe one of the main things especially the younger generation looks for in an employer. See, Tata is Tata because of the work they have done for the past 100 years, right? When you get a interview call from Tata, even if the salary is less, even they say no to it because it's the brand value they have created. They are
Mhm.
known for taking care of the communities as well as taking care of the society. So I strongly believe being projected as an ethical company within and outside the organization really helps for the employees. The second thing is that the employee volunteering is a very important tool. Through employee volunteering, a lot of employee engagement happens, and they builds up their various skills amongst them, be it management skills or interpersonal skills, or even the whole thing of feeling happy to work for organization who cares for the wider society.
Mhm.
And that's what you became a catalyst of change. Often I have seen employees who have come back to me saying that I really feel proud to work for AkzoNobel for what it does not only in business but what it does for the wider community.
Right. So lovely to hear that these are the outputs of volunteering. Are there any specific volunteering opportunities that you want to share with us? For example, is there volunteering in the skill training focus area or the education focus area? What are some opportunities for your employees to really be at the grassroots level?
Yeah, we always encourage volunteering in terms of according to one's area of interest and one's area of skill.
Hmm.
Suppose some people are really have good knowledge about the different career opportunities which is available.
Mhm.
Especially the government school children, unfortunately they are not exposed to know about various career opportunities. If you go and talk to them, either they will say they want to go to become a policeman or going to go to military, or
Yeah.
the girls especially would say they want to become a teacher, right? But things have really changed and evolved over the past 10-15 years. So it's very important to them that if somebody comes from outside, talk to them about career opportunities. So definitely one of the things very important where I get a lot of help from the employees. The second thing is that of personal development. Again, the soft skills, as are very important nowadays. Even if you're very good in studies, unless until you have good soft skills, it's difficult to move ahead in life. So soft skills in here, I get a lot of volunteers who works and uses the soft skills. Now coming to about vocational skill training, the good part, as I told you, being a paint and coating company, we have a lot of expertise and knowledge in paint application. So
Mm-hmm.
they help us in getting the syllabus, the content of the vocational skill training. They help us with ensuring that the students get placement, especially the sales and marketing team, because they have a lot of networking with paint applicators and employers like paint contractors. So they help us with that also. So, when I talk about volunteering, it's not only just going there or giving out the prizes, but then, being the core of it, right? So the volunteer helps us, right, to designing the course content, to placement in skill training, for education, help us designing quiz programs or, designing content and how personal development classes can be pursued. So these are the various, things we look for.
Great, great. Thank you for sharing. I think that was very insightful, especially to learn about how you can match the skills to the need and create strategic support, if not grassroots support. It's not necessary that every person has to be in a school or
Exactly.
be there. That's wonderful to hear. So this brings me back to the topic for today, which is the pros and cons of telemedicine. So for the benefit of our audience, could you first and foremost just describe what telemedicine means? Because it's a fairly new concept which has really been highlighted during the pandemic. So I think it would be great for you to just spend some time elaborating on telemedicine.
Sure. So basically, simple terms, telemedicine is a interaction of the doctor and the patient through technology. So technology can be through a mobile phone. It can be through a laptop, or it can be it can be a video call, or it can be even a voice call. So wherever there is indirect interaction, non-physical interaction between a doctor and a patient. So this is mostly described as telemedicine. So coming to telemedicine, though, to be very honest, it's not a very new concept. It's been now 21 years since the first telemedicine project was launched. It was launched by ISRO in 2001, and it connected the Apollo Hospital of Chennai to one of the Apollo Rural Clinic in Andhra Pradesh. But its acceptance in India have been a challenge. Various reasons for that. Of course, first reason is that low internet penetration, availability of steady electricity in the rural regions, and even a forthcomingness of the people, because when one thinks of doctor, it was very difficult for people to think of going for treatment without having the doctor in front of the person, right? So
Right.
unless until the doctor touches you, you don't feel that the doctor is paying enough attention to you, right? So
Yes.
there was huge hesitancy. Many organizations, even government tried to promote telemedicine, but honestly didn't work out. I think COVID became a game change agent, right? So suddenly, we all knew, in 2020, in 2021, how difficult things went for every one of us. So even you had money, you didn't have access to doctor, right? So I think that is the one situation that really accelerated the program, the acceptance of telemedicine. And suddenly started people accepting telemedicine as a medium of getting treatment, and this is when it became popular.
Absolutely. I think COVID really ushered in the digital age where we started accepting that it's okay for kids to go to school for 2 years at a stretch online. And if that's okay, then it's okay to even have your doctor on a screen, right? And I think it really helped with that hesitancy factor. I don't know about the rest, about the electricity, about the low internet penetration, which you mentioned, but at least the hesitancy and the trust factor has improved in that sphere.
Right.
Right. So why don't you now tell us a little bit about your telemedicine project and how it's going?
Yeah, so basically, the good part is that we initiated telemedicine program in 2018. We started up with the rural district of rural Bangalore.
Mhm.
And as I said, it was still people were hesitant about using telemedicine. But if I talk about rural locations of India, I think the biggest challenge people face is availability of doctors, or availability. You can just forget of specialist doctors. Hardly you find doctors in the rural areas. I will just give you one example. Like so we one of the locations where we have telemedicine project in Bhind district of Madhya Pradesh. The place is called Malanpur, and it has got a population of 50,000 people.
Mhm.
And it's just one PHC which has two doctors to cater the population of 60,000 people, right? And it happens often happen that the other doctor is absent for any reason, and there's only one doctor catering to population. So
Right.
it was becoming impossible to cater such a huge population, only one doctor. And we realized that being a technology driven company, we realized that there's a lot of opportunities. Why can't we use technology as a medium to solve access of healthcare?
Right.
And that is when we engaged with an organization called Telehealth Foundation. It's a CSR arm of RxTX Super Specialty Hospital, Bangalore, which was already a ready-made solution. They were already running telemedicine program in northeastern part of India.
Okay.
And we started discussion with them that what do you think? What is the scope of telemedicine in rural locations of India? And as a pilot, we started in Bangalore, Bangalore rural district.
Okay.
We opened up 4 centers, and and we started the program. And The daily count was not great. 20, 30 patients used to come, or 40 patients used to come maximum. But as I told you, in the with the advent of COVID 2020, people understood the importance of telemedicine, because the hospitals were overflooded. There were no doctors available. People were scared to step out of their homes. And diagnostic is very important. Diagnosis is very important. You cannot just do self prescription, right? That can be lead to really disaster. So people realized that and started coming to the clinics. And that is when they opened up the second center at Bhind district of Madhya Pradesh, where the citizen population depended on one doctor. The base part was the support we got from the state health departments of both Karnataka as well as Madhya Pradesh. They were absolutely forthcoming. They said, we are completely for it, and even telemedicine in one area, the government was putting a lot of focus onto it, and they were very cooperative. They immediately gave us permissions. We set up the telemedicine centers in the primary health centers. The doctors very very cooperative. And how it works is that we have two types of services what is available. One is a fixed center, where the telemedicine center is located inside the primary health center. So whenever any villager comes to visit the PHC and the doctor feels that the person needs to be consulted by a specialist, the doctor immediately sends the person or the patient to our center.
Okay.
And the center, as per the person, as per the availability of the doctor, gets himself or herself checked up. And in case a specialized, like for example, a pediatrician or gynecologist is required, and that point of time the doctor is not available, then they fix up appointment of another day and time, and the person comes back. So that all the telemedicine centers are equipped with a paramedic, because it's very important that support service, or getting the vitals checked up, is basic requirement. And also the language barriers, like so basically, if you work in different parts of India, all the villagers won't understand the doctor's language, the doctor won't understand the villager's language. And that also gives a lot of comfort to the patient, that there is one person sitting with her or him, that that speaks the local language, and that taking the vitals, like unless a little prescription, somebody puts a stethoscope in the chest, you don't feel satisfied. And I must say, technology has made rapid strides. So there is a digital stethoscope. So basically, if you put the stethoscope in the patient's chest, the doctor, from thousands of kilometers away, can actually hear exactly the heartbeats. So prescription, diagnostic services becomes a really really easy. So this is one model which has really helped us in increasing the reach of access of healthcare. Nowadays we are seeing great results. We are seeing over 150 200 patients coming every day for the telemedicine project. So the acceptance have increased. The doctors have been relieved towards a large extent, because it was overburdened. That is really helping. I'd like to talk about another project, similar project we are running, called Arogya Sakha. So this is a telemedicine project for painter community. As you know, painter community is one of the most downwards community in the bottom of the pyramid, and they are mostly daily wage laborers. So hardly they have access of healthcare. Even the fees of doctors, are quite high. And if one visits a government hospital, almost the daily wage is gone. So to cater to this need, we have started this program called Arogya Sakha. So it's a helpline, where through which it's operational 24/7. So the painter can just call up the helpline, fix up the appointment with the doctor, for any doctor, or as per the need, and as per the designated date and time. The doctor will call up the painter or his family members, and do the diagnostic services. The best part is that even if you don't have a smart mobile, there's no different mix, because you can do it through a feature phone over a voice call, and once the call is over, the doctors send the prescription through a hyperlink. So the patient can go to a medical shop, and the pharmacist can just download the hyperlink, and take the prescription, right? So
Wow.
this particular project is helping almost 1.6 million painters all over India. And it's becoming increasingly popular day by day.
That is so wonderful to hear. And by any chance, do you know this off the top of your head? How many phone calls are you getting per day through Arogya Sakha?
So we get, I would say, the consultations around 600 to 800 consultations, around a month. So I would say 30 to 40 calls, 30 consultation or 40 consultation happening every day. So you can
Wow.
say around 100 150 calls per day.
And how do you do outreach for this telehealth helpline? As in, do you just distribute it through different NGOs on the group on the ground who are already working with the painter community, or how do you spread the word?
Yeah, so basically you are right. So what we have got, a huge database of painter community, because paint company, we have a huge database of the painter community, and we have given the entire database to the NGO, to the various NGOs we are working, the Telehealth Foundation, the prime partner for us this project. They individually call up all the painters. They update them about this particular project, because you can understand, for a painter it's not easy. If I just tell him that this facility is available, right? So you need to orient him or her about this particular project. How does it work? Because
Correct.
people are scared to do a calling, or how will it work, a doctor with a over phone.
Yeah.
So we have telecallers 24 into 7. They call up all the painter community, and we have till date we have called almost 80,000 painters. They orient them about the entire process, and they also tell them that if you face any problem, you can always call back in this particular number.
Wow. So it's a very large
Helpline.
project. It's very good to
Yeah,
understand how this works, because this is a different level of hesitancy you have to overcome, because there's no video even involved, right? It's
absolutely.
your phone. So it's very interesting to understand how you're overcoming this barrier, and providing this service. And I think you must know a lot about the pros and cons of telemedicine, because you've been so deeply involved with both of these individual telemedicine projects. So what do you think are the pros and cons off the top of my head? Let me ask you, do you think there are hesitancies from the doctor's side also, because they are afraid of liabilities in such a project? And anything else you can elaborate on in terms of pros and cons? Over to you.
Yeah, I would like, you have rightly pointed out. So the biggest roadblock was, of course, there was a hesitancy from the doctor's point of view, because there was a lack of legal sanctity, of this entire telemedicine project. This changed in March 2020, when Niti Aayog, along with Medical Council of India, taken out the telemedicine guidelines. So after March 2020, telemedicine is absolutely legal in India, and they have rolled out a detailed SOP of the entire process. So that has really helped the doctors in terms of legality of this entire thing. Now talking about pros and cons. Pros, we all know that a country like India, where 75% of the population lives in rural region, but unfortunately 25% of doctors lives in the rural region, right? So there's a huge gap of number of doctors per Indian. So obviously telemedicine is one solution through which a larger population can reach to a doctor. And it's also true that almost 70% of the cases a doctor doesn't need to physically always check up, to come to a diagnosis, initial diagnosis, right? The second thing is that definitely it also helps us for a country like India, the reducing the cost of medical care. Because if you started up building hospitals in each and every village or each and every taluka, it becomes very difficult. So definitely, then in terms of economy, it's much cheaper to set up telemedicine centers. The third factor is that provides safety, especially in contagious diseases. We all remember in COVID, the same thing happened. Even doctors were scared, to be very honest, like us, they were also scared. So telemedicine was one area through which a patient could communicate with a doctor, through a telephone, and it's absolutely safe. Most importantly, it provides digital records, because in India, what happens, especially in the rural regions, people lose the hard copies. So if you lose it, the entire case history is gone. It's very difficult when you do a follow up with the doctor, especially if you go to another doctor. So this is also helping in digitalizing the record, because again, the Medical Council of India have given a very detailed guidelines, what needs to be followed, which are the record that needs to be recorded. Now, if I talk about cons, as I initially pointed out, India is a country, though we have made rapid strides, in terms of technology, but it's also a fact that, it's still the penetration of internet is really low in the rural regions. We all know that even getting basic electricity, continuous electricity is a difficult task, right? So unless until you have electricity or you have internet connection, it becomes difficult. Like quality of medical care, because I would say, like you can always do a voice call, but then video call makes the process more effective. The first one. And the second one is that telemedicine without a facilitator is also a challenge, because it's always helpful if you have a health worker who facilitates the entire process. So telemedicine alone is not very effective. Telemedicine along with a facilitator or a healthcare professional, that is becomes more effective. The third point is that we all know that telemedicine can be one of the important tools, but it cannot be the tool of the entire treatment process. Getting the initial diagnosis or just to find out how serious the problem is, it can be done through telemedicine, but it cannot be done for a complete treatment of the patient. So ultimately you have to go to a doctor, especially in cases that if the disease is serious and the doctor feels that you have to go for further treatment. For that, telemedicine is definitely not very effective. So every like in everything, it is pros and cons, but I would see the pros are much more. At least it's providing some access of healthcare to the population, especially in the rural regions.
Absolutely, I agree that there are pros and cons of everything, especially a subject as new and controversial as telemedicine. So I think there are definitely pros and cons, and the pros do outweigh the cons in a low middle income country like ours, where, as you mentioned, 75% of the population doesn't have regular access, and there's no solution. We cannot just keep hoping that doctors choose to live in rural
Yeah.
areas. That is, it's not a reasonable ask. So it is, telemedicine, I think, is the way of the future. And like you rightly mentioned, it needs to be some kind of hybrid model. It cannot be completely telemedicine reliant, and there needs to be some kind of facilitator, anganwadi worker, or a nurse, some kind of middle person facilitating the process in the native language as well, which you mentioned is such a big comfort factor for a patient who is in distress. So thank you for really elaborating the pros and cons very eloquently. I think we shall shift gears now and talk a little bit about you and your background in CSR. So, my next set of questions is going to be for the benefit of our young audience who is maybe looking at CSR as a potential career option. So, I'm aware that your background is in social work. So, is a master's in social work or undergrad in social work the only way to get into CSR, or are there different paths?
No, no. I think definitely many companies prefer to have people with background in social work or rural management, or even social sciences. But I see a lot of people after doing masters in business administration or even in other field also coming to CSR. The most important thing is that you should have a very a strong sense of working for the society, which is very important. Our good understanding of the community development tools, which is again more important, and some background experience, which is equally important. So typically companies, if you ask for a general profile of a CSR professional, companies generally prefer to have people with some educational background in the social sciences. And in terms of experience, they prefer to have someone which has experience in social development sector, be it in CSR or even NGOs. Like CSR has been last 7 8 years, but then earlier most of the people like me used to work in the social development sector, right? So basically, this is the typically the background companies prefer to select people from. But definitely, it's not a hindrance. If you really want to work in this field, you can. There are plenty of opportunity available for non-social work background also.
Thank you for sharing that. I think it's important for our viewers to understand that there is not one straight way to get into CSR, especially because it's such an interdisciplinary field, right? Like, you're working in education, you're working in skill development, you're working in healthcare. So I'm sure a typical day in your life is very exciting and interesting. So my last question for you is, what does a typical day for you look like?
So depends basically, because either you're in the office or in the field. I always find visiting the field is more exciting because this is where the real action happens, the real change happens. So, typically I just say talk about both. So if I am generally in office, it starts various things that happens is that sometimes I have project reviews with the different NGO partners. Sometimes I have various documentation work, in terms of preparing reports, preparing MIS for the management, then, preparing budgeting, because, again, compliance is a very important part of CSR now. So a lot of compliance you have to follow. You have to ensure that budget is on track. Nowadays budget can't be carried forward also. So we have to do a regular reviews of the program as well as the budget, right? And also it involves interacting with the management, updating them. What is the current update? What is the, like, next plan? Uh, what's the next quarter plan for us? And generally, most of the companies have a CSR committee, which is governs the CSR activities of the company, and most of them do a quarterly review meetings along with the CSR team, which talks about the past quarter performance, how have been the performance in terms of how much impact could we make, what was the budget that was spent, how was the budget spent, and again, what is the next quarter's plan. They also provide a guidance in terms of in terms of the outlook. Like every CSR committee also has generally a independent board member, which is generally they have a specialization in this social development. So the person also provides you a lot of guidance in terms of where to go, where the organization sees itself in the long distance, right? And if you're in the field, so obviously you mix with the different stakeholders. Like if I talk about education project, I would like to meet the school children, the school teachers, the principal, the district education officer, because we also want to understand that not only the great things we are doing. For every project there are always some great achievements, but then there is always some gaps also that happens. It's bound to happen. So it's very important for us to know that what are the gaps that is plaguing the project, and what can we do to address the gaps. So we interact a lot with the stakeholders to understand what does they think about the program, what are they advise to improvise the program. Are there any specific things that we can do to make the program more effective. So getting stakeholders feedback is very important. So that is what I mainly do while I visit the projects on ground.
Very interesting. I think your profession is a perfect mix of desk work and being, indoors and paperwork and also field work and meeting people and being a very people centric role. So I think it's a very good balance. And you also, of course, at the end of the day, have that fulfillment that you are doing something good for the betterment of society. So I'm sure that is what probably drew you to this field. I'm just going to actually wrap up with one more last question, which is regarding telemedicine. So, as you're aware, Mission ICU does work in ICU setups, and we provide equipment to beneficiary hospitals to run an ICU for 10 beds. So, keeping that in mind, I just wanted to ask you, what do you think the scope for telemedicine is in an ICU setup? Because I know your projects are in a PHC setup, and even the helpline is, I would think it is mostly, GP related queries that you would ask your general physician. But in an ICU setup, it's a whole different ball game. So, do you have any thoughts on that?
So as you rightly said, ICU is a different ball game because it's very serious, and the patients who are there in ICU needs constant medical care and advice. So of course, there has to be physical doctors present in the center. But I think what value addition can telemedicine do is that this can help you to get access of doctors and get their second opinion about cases in the ICU. And through telemedicine, you can get best of the hospitals around India. Best of doctors of India give their second views, because especially in medical diagnostic services, I think getting views from the specialist doctor or the expert in the field is very important. And I would say especially it's important for people who are in the ICU, because one wrong move can jeopardize the patient's life. So I think doctors has to be present, but then telemedicine can be a great tool to do a value addition and give a second line of advice to the doctors, and even provide them guidance.
I think you've rightly said that someone needs to be there, and someone with considerable professional experience needs to be there. Something that we have noticed in conversations with people like you is that telemedicine can be acceptable in an ICU setting as long as the GP is the one who is performing the tasks, while the
Absolutely.
specialist or the intensivist is guiding in a through tech and technology interface. So I think that is one model that could practically work and might become popularized in the future. Who knows? But I think we are good to conclude today's conversation. So I'll just end by saying thank you. It's been wonderful, and more than wonderful, it's been insightful. So thank you for taking the time, and I hope you enjoyed this conversation.
Absolutely same. Yeah, it's been a great privilege, and it always feels great to share information, to share whatever learning you get, with the wider community, because we all grow by getting different ideas and different knowledge. So I think it's been great talking to you, and thanks once again for inviting me.
All right, everybody. Bye bye. Thank
Thank
you.
you. Bye.